What's up, people? How's it going? Happy Tuesday. I hopefully you can hear me. This is a new setup. I don't know if you know, I got a mic here. I got a new camera. We got a lot of stuff going on. So let me know if you can hear me okay. And I got my computer right here. So that's what I'm looking to see what you guys are talking about in the chat. Actually, maybe I could do it here. It's like a live pad. Maybe that'll work. I don't know. We'll see. Well, now you do, Julia. Let's see. Let's get on the YouTube on my iPad. See if this is going to work out. I don't know. Can't tell. What are you guys doing today is the question. I finally have a day off, so that's pretty awesome. So I got all this stuff set up. So I thought, let me try it out with a little live sesh. You know what I'm saying? So, oh, that's good. Ads are playing on my live. That's good. TA in class, studying for bio. Failed your physics. That's no good. Why'd you do that? Oh, I gotta turn this down. Shit. How does this work? But I want to see the. Can I see? Huh. Can you guys hear me okay, though? That's the question. The camera's really good. This is looks really good, huh? What serious upgrade from my my webcam before from my computer. So I'm pretty stoked about that. Man, I don't know how to see the comments without putting this computer right in your face here. Try not to not look at everybody. Okay. All right. So I'm gonna check some comments here. How often do I take trauma call? I take trauma call every day. I take general surgery call. I take trauma as well. That's how our deal works. That's not how everybody works, but ours is. So this month I have 15, and next month I have 14 or something like that. A lot of months I've been doing over 20, and I I get paid per shift. So it makes a lot of sense for me to work more, but it's it'll beat you down, right? So I kind of the last couple months I decided to back off and just work 2 weeks a month on taking call. And then because I don't do elective surgery, so I'm not in the clinic and doing elective cases, and I don't have a day where I just go in and start a surgery at 7:30 and end at 3 and then go home and I'm not on call. Every day I'm on call for 24. So if I do over 20 days a month, then that's a lot of call. So I decided I was going to back off a little bit. And so actually, this is what I did is I got a new camera and I kind of upgraded my gear, and I'm going to start making much better YouTube videos. A little bit more stylistic. I want to do a lot of educational videos for just, hernias and gallbladders. I've done those things, but I want to branch out and do a lot more. And then also I want to do suturing tutorials and things like that. So that's my plan. Tips for the exam. Which exam? Any advice for nursing pre-med students? Yes. Why are you in nursing if you're pre-med? I don't understand that. Why? You don't need to I feel like that's a lot of people do this. I'm just not picking on you, but a lot of people go into nursing because they want to be a doctor. Well, a nurse and a doctor are two different things. So you want to be a doctor, go on that track. If you want to be a nurse, go on that track. Either one is fine, but don't do both because you're just taking more time to do something that you don't kind of need to do. There's a lot of different reasons for that too. It's not just extra time, but the people, when you're in nursing, people are different and they look at things differently and they go about life differently. And when you are with medical students or pre-medical students, they do life differently. So if you want to ultimately be a doctor, then go into pre-med and not nursing. There's no reason to be like a nurse for a couple years to get experience to be a doctor, you know? Deb Patel, what's up, dog? Give me 99 cents. Crazy. You guys are crazy. Did you ask a question, or are you just like throwing cash? Okay, so Julia asked a really good question, which I get a lot, and it's a very big like misconception. Okay, so how close did you work with orthopedic surgeons? And are there women orthopedic surgeons? And at 5'2", can you be an orthopedic surgeon as a woman? The answer, this question actually drives me absolutely fucking insane, because there are a lot of orthopedic surgeon women, number one. Like people from the outside. This is why I made that one video that was like a total parody about like if your personality is this and you go into that, because it's just like the characteristics or like a prejudgmental kind of way that people look at certain doctors. And one of them, the orthopedic surgeon, is like the jock, right? That's really strong, and he has to be like muscular to do orthopedic surgery. You don't fucking have to be muscular to do orthopedic surgery. Football players that go into orthopedic surgery think that they do, but they don't. I know multiple tiny women that are orthopedic surgeons, and they do just fine. They figure that shit out, you know. There's just, and I work a lot with them, orthopedic surgeons, and I know, like I said, I know lots of surgeons that are women. At this point, like, I think even over 50% of surgical residents are women. So that's the big misnomer and miscommunication. And honestly, to tell you the truth, I think it's just because of the whole, like, how society is right now. Like, everyone's like pro women and like fuck men, and they've been you know, beating us down and all this stuff. It's like, but that's not the truth. Okay, is it harder for women? Yes. But are they there? Yes, absolutely. Over 50% of women, over 50% of surgical residents are women, like at this point. So, and I work with like tons of women. It's a pet peeve of mine. Don't listen to the fucking media. They're just poison. All of them. Okay. Just go and talk to people that actually know. Because I'm fucking, this live stream is high quality because I'm streaming 4K, dog. I got the new video, new camera. I got the link. I got the mic. I'm stepping the shit up. What do you think about that? My new videos are gonna be sick. You know Peter McKinnon? Okay, that's how my new video is gonna be, except about medicine. Slow-mo, like music, sick ass stuff like that. Actually, I could play some music right now. Let's see. Let me find some music. What kind of music you guys want? Because I have, so I got a subscription to like this music company that lets you put your music on YouTube, just for these badass videos that are be coming out pretty soon. I'm out of sync with the audio. That sucks. I wonder if this thing's too far, or maybe this thing is not that good. I'll have to do the camera next time. Camera audio. Heavy ass metal. Let's see. I'm gonna search it right now. We'll just try it. What do we got? Okay, this is out of my computer, so I don't know if this is going to work or not. No idea. Can you guys let me know if you can hear the heavy metal? How should you prepare for pre-med school as a pre-med in college? Oh, for med school as a pre-med in college. Deb Patel. Oh. Why'd you retract your comment? I'll try a couple different heavy metal songs. I like this one. So this stuff is not real, heavy metal, but it is. I'm allowed to play this on YouTube because if I play other music that is copyrighted, the fucking video gets pulled. So I get jacked by YouTube. I did The Good Doctor. I did a fucking half an hour review on The Good Doctor, and they pulled it because I had too much of the show in there. Hard to switch to surgery from engineering. No, you got to go back and do like 2 years of undergrad probably for prereqs and stuff. But otherwise, like engineering is difficult, and you probably have really good study habits and life habits. So in that sense, I would say no. I don't know the difference between the UK and the US doctors, so. Oh, shit. So you were nursing, but then you realized, I would switch. If you really want to do medicine, go get around those people. Get around pre-medical students that are kicking ass. And, that's the group you want to be in. That's very, very important. You don't want to be in nurse. If you do 4 years of nursing, you'll probably be persuaded, not in a bad way, just because you're around those people. You'll be persuaded to go into nursing because you'll be like, oh, nursing is better because of all these things that I learned in nursing, blah, blah, blah. But if you're right now, you're like, I want to do medicine, just go. Any book recommendations? Yes. Adam Jones, $5, throwing it down. Game Changers by Dave Asprey. It's a very, very good book. That he takes like all the very high performing people and he interviewed. Well, it's basically a research paper on his podcast. His podcast, he interviews tons of people that are very high performers, and then he finds out what are the things that they all have in common. Then he tells you. It's fucking awesome. Can you practice emergency medicine as a DO? Yes, you can do that. What percentage of my day am I doing surgery? So yesterday, for example, I only had one surgery. I went in at 8, and I just had one operation. It was about 45 minutes. The other time yesterday, I was doing paperwork, rounding, talking to patients, talking to nurses. I have a PA that I talk to. And then what else? Just bullshit stuff. And then some social media. Actually, yesterday I didn't go to A. I forgot. My phone. Okay, you guys want to hear a story real quick? I'll answer questions, but I'm going to go back and look at these questions. But yesterday, Sunday I was on call. So I was on call for the last 9 days. Saturday, I go to sleep. I can't remember what time. I charge my phone. I wake up on Sunday. The phone. I look at my phone because I always look. Did I miss any messages overnight? Is my problem because I always I sleep through them sometimes. So I look at my phone. It won't turn on. I'm like, oh, I must have not charged it. It died. I go to charge it. I take a shower. Come out. Nothing. So essentially, the phone completely died on Easter fucking Sunday. So I'm on call for 2 more days. It was a clusterfuck. So yesterday I had to go in to go get a new phone. Of course, they won't give you a new phone. They have to ship it to you. They can't just say, your phone's broken. Here's a new one. Here's a SIM card, blah, blah. I paid for the insurance, all that stuff. No. We have to ship it to you because I don't fucking know why. So I still don't have a phone right now. So I haven't been doing any social media. Do you guys like the song? Or should I change it? What do you think? What do you do to increase your chances to get into med school? You crush the MCAT and you get a fucking over 3.7. Okay, those two things right there will probably get you in. Don't be a douchebag when you interview. Be nice, okay? And have a reason that you're going to med school. They're going to ask you. They want to know why you're going to med school, and you got to tell them a good reason. You have to tell them a reason that when it gets really, really hard, and it gets hard, and every single person that goes into med school at some point, med school and residency, wants to quit. Okay, I wanted to quit like basically every day for like 10 years. Maybe not 10, maybe 5. But so what is the reason that you are going to not quit every day for 5 years? You tell them that, and that will get you into med school. You got to get the interview first, and that constitutes over 3.7 and an MCAT, high MCAT. Okay, I got a couple more. You guys are, I appreciate the money that's going to all this new equipment. So we can bring some more high quality stuff. My take on Caribbean schools that are accredited but not in top 4 or 5. I think you're pushing your luck. I think that if you got to go to a Caribbean school, if you can get into the top couple, that will highly increase your chances of getting a residency. If you go to St. James or something like that, can you do it? Yes, absolutely. A lot of people focus on the average. What does the average Caribbean student do? The average Caribbean student doesn't get a good residency, doesn't do very well. But if you focus on not being average and being excellent, you can do it from St. James. I did it from St. Matthews. The thing was like 4 years old. Nobody knew who the fuck that school was. And I got a surgical residency anyway, because I didn't focus on being what is the average person going to do. I was like, fuck those guys. Hopefully I'm not that. Hopefully I'm like way up here. And that's what I promised myself, and that's what I focused on. And I got straight A's. I did well in the USMLE, and then I got interviews from that. Even though my school was a no-name school at the time, it still kind of is. I probably wouldn't go there if I could get into the other ones, big ones. Okay, Gavin, what is your question? Do you guys like the song? I forgot. Did you guys answer that? Yes, I'm going to try to do this regularly now. I'm going to have to try to find a time because my schedule is kind of all over the place. I want to do it here because obviously I have my good camera now and all the 4K streaming live, which is dope. And I'll get a better mic. I got a boom mic coming, so I don't have to use this. It's like this is USB. It's probably not as good. Gavin just gave me 99 cents. Just no question or what? Can the average Joe become a doctor? I believe this. Okay, this is the reason I do these videos and my YouTube and all that stuff, because I think that I'm the average Joe, and I just focused and decided what I wanted and then went after it. And so I do believe that you have to become a different person though. You have to go from average and be extraordinary. Okay, but everyone has that capability. That's what I believe. My med school was St. Matthews. That is now in the Cayman Islands. I was in Belize at the time. They changed the location of the school. But Mina, Dev, did you ask another question? And Mina, I don't see a question from you either. You guys just give me money just for my new camera? That's awesome. I got like at least $5 right now. It's like only $1,995 to go. This new camera was $2,000. Actually, it was more than that. It was like $2,600, but it's totally worth it. It's awesome. Do I recommend a fellowship after residency? I do, but it depends on what you want to do. When you do fellowship, depending on what residency you do, you're also narrowing your focus. And so when you narrow your focus, you also change the location that you can practice in. If you are a family medicine doctor, you can go to basically any town in the United States and start working. If you are a gastroenterologist or an interventional radiologist, you cannot go everywhere. Not every hospital has those and requires those. So that is something that I didn't really understand. I thought about going into neurosurgery, but I really wanted to live in a small town in Wyoming. And those two things are not compatible. And so I decided not to go into neurosurgery, not just that, but other things. But I did do general surgery, which is also not really, allows yourself to go into any town and just start working. Are all the doctors GPS, as in MBBS or MD, without specializing, or is GP a specialty after grad? All GPs? No, you're probably in Europe, but in the United States, you're not a GP. You can't. That's a little bit of an old term, and not many people practice as a GP anymore. They mostly call it family medicine or family practice. And that's a fellowship of 3 years as well. I mean, not a fellowship, but residency of 3 years. There are older guys that did a 1-year internship in rural wherever, and they just started practicing, and now they're 60 and they just keep doing it. And those guys are still kind of sometimes call themselves GPs. Hemal, thank you so much for your comments. That's awesome. Is there priority given applicants with master's degrees? I really don't think there is. I think the big two are GPA and MCAT score. If you have a master's degree, I would ask, if I was interviewing, I would say, why did you get a master's degree if you want to be a doctor? And if you say, oh, well, I didn't do good and I want to get my grades up, I'm like, that's the first thing I would think of. If you said I want to be, I want to go into medicine and do administration, then that's different. Then you'd say, oh, okay, you did healthcare administration, master's, whatever. And then I would say, okay. Or I want to integrate medicine and engineering. I'd say, all right. But just to do a master's to get your grades up is not I wouldn't tell anybody that. Let's put it that way. These fuckers. Hope there's nobody really too young on here, but unfortunately, the admissions committee and stuff, they have their specific things they like and don't like. And I used to be oh, I have to tell the truth for everything. And honestly, that can hurt you. Unfortunately, in real life, you should tell the truth and you shouldn't bullshit people. But these bastards in these admission committees, they don't give a shit about anything. They're just trying to get the best students in their class so they have high scores and they can tell everybody their school is amazing and get more money. So fuck that. Use that to your advantage. Make sure that if you're doing a master's, you have a really good reason to do that master's. What do you do if you can't focus on your lessons? I think this is a global problem right now. most students have a tough time focusing because we're so used to our devices like breaking up our concentration. And there's a lot of, actually, I was just reading a book talking about focusing, and there's a lot of things that you can do. And this is one of the things I talk about a lot in my study course, but I'll give you a brief overview. Number one, you have to put those, we get addicted to breaking our focus. When I don't even have my fucking phone because I lost it. So we have an iPad. Every time the thing goes off, we pick it up and look and message somebody. So you have to break that. You have to get to a point where your brain is not like every 5 seconds, like searching, am I going to get an email? Am I going to get a text message? Do I got to look? And I get like, at this point, I'm like that too. I'm paranoid that I'm going to miss a phone call from the hospital. And so I'm always looking at my phone, and I feel myself getting to the point where if the phone doesn't go off, I have to look at it and make sure it didn't go off. That's bad. If you're like that, you need to get rid of that. So you need to set that phone aside, turn it off, turn all like email, text messaging, all that shit off. And you have to practice, and you might have to practice going from 2 minutes to 5 minutes to 10 minutes to 20 minutes and not working, not like reading, right? Just sitting and not fucking trying to look at something else and focusing on one thing. Maybe it's just like maybe it's watching TV, or maybe it's watching something without commercials, so you can just focus on one thing. It's tunnel vision. And then go to reading and read 5 minutes, and you just have to like start. It's like working out, First I start with weights of 5 pounds, and then I move to 10, and then I move, you know what I'm saying? So you got to do that first. Second, everyone eats way too much sugar, and that will fuck you up too. You have to get rid of a lot of simple carbohydrates. And if you exercise in the morning, then you will have a sharper brain and you'll be able to focus more. Those are just 3. There's a whole bunch of things, but those are the big 3. What kind of music you guys want now? Any advice on dealing with death for med students? I'm not really the best person to talk about this because I never had a problem with it. That may mean that like I have a personality disorder. I'm not really sure. Probably the psychiatrist will say that, but I feel like, for me, like medicine is and death and life and all that stuff is kind of like my religion. I mean, not exactly, but in a sense. And so I've just become used to it. At first, it really, like as a med student, what the fuck is your problem? Because you're not even really taking care of patients. When you're a resident, you're actually taking care of patients, and people die, and you could be like, I may have been able to save that person if I would have done X. So when you start having those feelings, then you start to think, man, this is tough. And the first, few of those where you're like, I should have done this, maybe that person would have died, you feel real fucking bad. But it is just time and practice, and unfortunately, having that situation over and over, and then realizing, hey, there's lots of things that go into when somebody dies. It's not just like today. It's not this last 4 minutes. There's a lot of things that go into that. So are you the last stop? You might be the last stop, and you may feel like, I killed this fucking person, right? And I don't think there's a doctor on this planet that has not felt like that one time. And people don't want to talk about that. They don't want to say, like, I feel like I killed this person, because that sounds terrible. But I bet you if you asked every single doctor on this planet, they would say yes. So you will have that scenario, and the more you experience it, the better you'll be able to deal with it. But as a med student, you don't have that responsibility. I didn't have that responsibility. So I never felt, I was like, this is great. I can do whatever I want. they die, it ain't my fault. Like that's enjoy those times, right? Put on some gangster shit. Okay, hold on. Search gangster. Let's see. Gangster. Okay, what we got here? This doesn't sound gangster at all. Oh, maybe a little bit. Hold on. This is kind of fun. Look at a lot of people here. How many people are here? 138? That's awesome. You guys are awesome. Fuck yeah. Fellowship in Japan will be counted on residency interview. Do you mean your fellowship in Japan is good here? Because I doubt that. I've had actually a couple friends who have done fellowships, have done residency somewhere else. Mostly, I think Iran. One guy was in Iran, and the other guy was somewhere else, Lebanon. Full general surgery residency. One of them was a practicing general surgeon for like 10 years, came back here, then had to do residency again. The guy in Lebanon, same thing. And then he came here, did a fellowship first. Now this is a sneaky way to get into residency. Let me tell you, this is very special. And I have not talked about this on any other video yet. If you're out of the country, you want to get a residency here, you've done a residency already, you could possibly get a fellowship that's not accredited to spend a lot of time with people in that program. So for example, this guy did a residency in general surgery. He came to our program. He did a fellowship in transplant for 2 years. Okay, he couldn't get a residency in our program. He did a fellowship for 2 years in transplant, got to know the people in our program. Everyone loved him. When it was come time for him to start general surgery, get a general surgery residency, they're like, no problem, top of our list, you're amazing, right? Because they knew how he worked for 2 years. That's a really good way to do that. I know another person, actually, she was from Serbia. She did I believe she did a transplant fellowship in Serbia, came here for general surgery. I'm gonna try to do this regular. I'm gonna actually I'm gonna upload a video every week. It's gonna be high quality like this, and then I want to do one live, and then I want to do at least one car video a week. That's my plan. This is gonna probably start in May. I better get my ass on it. 23rd. Opinion, CRNA or OR, in the OR, do I have a PA? So CRNAs are people. They're just like everybody else. Some of them are good and some of them are terrible. Some of them are amazing. I've been to hospitals which do not allow CRNAs at all. I've been to hospitals which only have CRNAs. It's all dependent on the person. In my opinion, it's their experience. So if they have a very good experience in their school and then right outside, or they have a good experience prior to their school, like lots of ICU care, and not just the bullshit like 1 year that you have to have like 5 years of ICU as a nurse in a very busy hospital. That's going to make a very good CRNA, because you see a lot of shit and you see patients that get real sick real fast, and then you apply your CRNA skills and you can take care of those patients. If you're an ICU nurse in a little shitty hospital for 1 year and you don't have a lot of experience, you don't see a lot of sick patients, you do CRNA, you're out by yourself, you're going to get fucking burned. And that sucks for the surgeon because I got to take care of the patient too with somebody that doesn't know what the fuck they're doing. That's my opinion on that. I do have PAs. We have PA and NP that help us, that assist in the OR. They're not worth a shit, but some of them are. So the ones that are trained, these guys have not been trained yet, so they're very new. So we're still training them. So it's tough. I don't get a lot of help. I have to move my hands, and then I have to move his hands. Move my hands, move his hands. So after a while, he'll figure out where he's got to go with his hands. But right now, it's not a in sync kind of thing. But I've been with PAs that like that. They've been doing a shit for the same operation for 20 years, and they're amazing. In all seriousness, what do I think about having sex with fellow med student girls and nurses and general staff at the hospital? So you're, first of all, a lot of people don't talk about this because it's a bit taboo. It happens everywhere. I don't give a shit what people say. Probably every single hospital this is happening, but nobody wants to admit that. You open yourself up for problems. I know people who have had relationships and had no problems. I know people that have gone, like in my residency, we had like residents dating each other and then breaking up, and then married couples like getting broke up, and other residents dating. Because we had lots of residencies in our program. We had medicine, we had family, we had ER, we had fellowships in transplant, we had ENT, ortho, neurosurgery, general surgery, like fucking tons of fellows. So there's tons of residents in my program. So there was lots of cross-pollination, if you know what I'm saying. Now this is also almost 10 years ago. So it was a little bit more lax at that time. I think things have tightened up quite a bit, and I'd be pretty scared to do that now. But there was a lot of fraternizing going on with residents, nurses, staff. Not so much like attendings, but everybody else. And maybe attendings, but maybe I didn't know about it. So right now, I would be very, very careful to do that. I think between med students is one thing. If you're on the same level and you're like in class and stuff, like that's normal. Med students date, like college students date. Once you're a resident, maybe residents date, but resident to med student to resident, resident to attending to med student, bad news. I know people have gotten fired for that. Chris, that was a good question. That's why I gave you some attention there. By the way, how do you guys like the hair? I got it cut. Do you like the short? I'm going short. I like it. Summertime. Cross-pollinating big time. Yeah, I would be concerned. The students don't get burned as much. The residents will get fucking burned. I actually had that situation, and nobody found out about that. And after I graduated, my diploma was in my hand. My chairman said, if I would have known about that before, I would have been forced to fire you from this program. So that scared the shit out of me. And so I would be very, very careful, especially resident to student. Nurses, man, it's just like, it happens so much in residency. I don't know. It's different now. So I'd be, oh yeah. Yeah. I know. It's a good time. I know. Okay, I'll have to get off of that before I get fired myself. Thoughts of going to med school around 30, full funding. I don't think that's a problem. I would not do a surgical specialty because they're too long. I would do an ER or a medicine, 3 years max of residency, 4 years school, 3 years of residency, 7 years, you're 37, you're 40, like that's okay. I would hesitate to be finished at 45 plus. Now that I'm 45, it's a long fucking time. It's a long time. It was a long time for me, and I finished at 35. People in charge are just jealous of a playboy. That's right. That's the truth. There's some bad shit went on. As in, one of a good friend, like a girl, also told me that she was being blackmailed by one of the administrators. That if she didn't show her body to him, that he was going to get her fired. Like fucked up stuff. Not good. Diagnosed with pleasure? I don't know what that means. This is going in the entirely wrong direction. Oh shit. I'm looking at some x-rays that I got from somebody. Free air. Free air. What's free air on a diaphragm mean? Anybody? You guys know what that means? Do a little quick little lesson. How many minutes we got? 42 minutes. I guess we could do an hour. I was going to do 30 minutes, but this is like actually turned out pretty good. Kind of having fun. Do I ever eat candy? That's like my favorite thing to put in my mouth. Almost. Perforation, yeah. So GI perforation usually. Pneumothorax is above the diaphragm. Pneumoperitoneum. Good job. Yeah, I would. I totally tried to collaborate with Dr. Mike before, and he wanted to charge me a whole shitload of money. So I don't know if that's gonna happen. I'm not quite at his level. He's at like 3 million followers. I'm like 100,000. Like this, and I'm like old and shit too. So he's like young and cool and shit. Although he's like family medicine, like what the fuck, hypertension, diabetes, preventative care, like whatever. He didn't get to do fun shit. I woke up at 2. Actually, got called at 12:30 last night for a chest tube on a patient that had a spontaneous pneumothorax who took Xarelto, which was for AFib, and so I had to put chest tube at 2:00 in the morning. Fuck Dr. Mike. Yeah, he seems so altruistic until you like want to collaborate with him. It was $30,000, by the way, for a post on Instagram. I was like, that seems steep, does it? Oh shit. But to his defense, like that's what people get on Instagram for 3 million followers. Like they get 30 grand a post. So it's not totally out of the question. I just thought maybe like collaborate with another fun doctor. There's not too many of us out there. Anyway. How do you overcome the segregation and IMG faces in the workplace? That's a great question. And I'll tell you how you overcome it. You be better than everybody else. And you will be judged and you will be segregated and you will be looked down upon until you prove to people that you are either just as good or better than them. And what I try to do is I've done a video about this. What I try to do is be so good that they're fucking embarrassed that they thought that I was less than them, and that usually works pretty good, And so you just work harder than them, and that's how life is. Everybody has a disadvantage in some way. Some people are, less disadvantaged than others or whatever. I mean, you look at some of these Hollywood actors. They make so much money. Everything just comes to them. Everybody just gives them everything. Like they have no fucking education. They're stupid as fuck. They're just like, good looking and they can read lines. I mean, like that's pretty much some of these people. Like they're really not good actors. They just kind of are themselves, or they don't become a character. They're just themselves. Like that's not fucking skill. So they are, they have a giant advantage over everybody else. Okay. So if you take that down to us, little people, we have our advantages and disadvantages. And there's a lot of people that say, well, I'm so disadvantaged, I can't do anything. I just don't believe that. Like, on our planet, there's so many ways that we can figure out how to improve like what we're doing. And so I just encourage everybody to do that. I mean, I'm not saying it's easy. It's not fucking easy. It's super hard. This is why I didn't finish until 35, and it's why I don't work at Harvard or Yale and stuff like that. I for whatever reason I fucked myself up, and then that became my disadvantage, right? And then because I had that disadvantage, I can no longer go to like Yale or Stanford or something like that. That's just where I'm at, because I'm gonna just do the best I can with that, And I do get people too that are very, prestigious or they're prestigious institutions to come and talk to me because I do this stuff like YouTube, Instagram, and authentic, which is not everybody. So that's, there's multiple ways you can cut this pie. Do I watch? I've watched Game of Thrones like a couple of them like way back. I have no idea where it was. It was probably like season 1, and I just never got really into it. So, Christopher, you're my kind of guy. Favorite bikini model? This is going off topic, you guys. How do you manage work and relationships as a surgeon? People hate it. Girls, like if you have a girlfriend or boyfriend, they hate it. Family hates it. You miss weddings, birthdays, blah, blah, blah. You do what you can, but it's difficult. You have to find people that are the people that are in your life are very, very, very fucking understanding. And this is how it happens. Yeah, most people hate, like normal people, they think it's fun to date a doctor until they realize what the fuck they got into, and then they're all of a sudden they're like, "This is horrible. I'm out." Should you get a PhD before residency? I don't know. There's very few people that have PhD and MD, and that is a very select group of people, and I'm not in it, and I don't see the reason to do that. I'm not a researcher. I like social activities like this. So, does it work for two doctors to get into a relationship? This is actually funny. What's today? Tomorrow, I have a video coming out about this. No, tomorrow. It's either this week or next week. I'll have a video about dating in medicine. Two doctors can work. Certainly, you're not home a lot, but you both understand each other, and so that helps a lot. That's probably the most important thing, is to be the other person understands what you're going through and they're okay with it. So, and you have to have trust too, because if you don't have a really good trust, then it's like, oh yeah, I'm coming home at 7. Oh, just kidding. I got another patient. I'll be here at 9. Just kidding. I got another surgery. I'll be there at midnight. Oh, just kidding. I got, what I'm saying? And so if you're not trusting, if you don't trust each other, then that other person's like, oh, is he like going out with a girl? Blah, blah, it's like the whole thing. But you got to be like really solid. Probably before you get into medicine, you got to know each other. Do I know who Dr. Hartman is? Like the doctor who invented the surgery, or different doctor? Dr. Mike may be the only family doctor making 6 figures. That boy is making 7 figures. I have a feeling, but good for him. I mean, that's the thing. Like, that's his advantage, right? Nobody, he's basically a model that went into family medicine, finished at 27. So most doctors are not young enough and done to actually present, the things that he presents on TV and stuff. Like, he goes over, preventative care, which is great. Raising awareness. People like him, because he's good looking and stuff, and which is fine. Like, he's using that advantage for a lot of good too. Not just, he's definitely making some money, but he's also using it for some good. So I think that's reasonable. That's why I don't hate him like completely. I don't hate him. Just kidding. Man, this is got 189. Dang, it's got crazy. "27, you decided to quit and go back to medicine. What's the one piece of advice? Just medicine. You just have to have a really clear goal and a really, good motivation to stay in it, because you're going to want to quit. So just make sure that whatever it is you're doing, you remind yourself why you're doing it. Are PAs treated equally? No, they're not equal. I mean, they're physician assistants, so they go to school for a total of 6 years, and somebody like me goes to school for a total of 5 plus 4, 9. No, that's not even 4 plus 8. 5 plus 8, 13. So 6 and 13 years. So that's a little bit of a difference. There's a lot there. Here's the other problem with with our society at this time. Everyone wants to make everyone equal, and we want to say PAs are just as as good as doctors. That's not true. They fulfill a different role. There are some PAs that have and nurse practitioners that have their own clinic and stuff like that, and they practice as kind of functioning family physicians. I would argue that they're not as good, only because of the experience. They just do not usually, okay, get the experience. Now, if an NP or a PA goes and does 6 years and then they practice under a physician for 10 years, right, gaining a bunch of experience, then you may have an equivalent kind of experience, but only after that time. So if you're just coming out of PA school, we had one, and he didn't know shit. But that's you're supposed to know shit. Okay, you're getting on the job training, and you're getting paid well for it. That's fine. It's a different animal. They're just two different things, and they're not equal. No matter what the fuck social media says or whatever else. But if it's a good thing to do if you are like, I don't want to spend 13 years in school. Well, fuck, that's fine. You can spend 6, get a good job, get a good salary, and be in medicine, be heavily involved in medicine. And that there's nothing wrong with that. They're just not the same. It just drives me nuts. Like, and I see on YouTube and Instagram and stuff like that, people trying to say like they're the same and just as, are so valued. They are valued. You are valued. Like, they're assistant. They allow me to do a better job, but they're not doing my job. Not even close. Yeah, I treat them with respect. Like, as long as they're doing a good job. If they're not doing a good job and they're fucking patients up, then I tell them and I beat the shit out of them, just like like the interns. But I don't think everybody wants to talk about that, but that's what happens. You're an IMG starting surgery, PGY1, want to get a categorical next year. Yeah, just, do the best you can. Do really well on that fucking ABSITE. These tests will make or break your career. MCAT, step 1, step 2, not really step 2 and step 3, it's really step 1. ABSITE, all that stuff. That's what people go on. It's the only, objective data that you can really go on. If you like somebody and they're a hard worker, there's not a lot of objective ways to test that against somebody else. So when it goes down to paper and these institutions are picking people, they can say, well, we check this box and check, check. Okay, we take it to the fucking chairman, and chairman looks at it with the papers and he says, oh boy, this paper looks good and that paper looks really good. This paper doesn't look as good because the numbers are not as good. Even though this guy, everyone knows that he's way better and way more personable and better to work with, they just look at the papers. So do really good on the ABSITE, talk to people, be like, hey, this is what I want to do. I want to get a categorical spot. This is my plan. I'm going to work as hard and as long as possible. I'm going to crush the ABSITE, and I'm going to be the best resident you guys have within everyone. I'm going to be better than all the categorical residents. That's my plan. I want to get a residency here. I really like it. if you don't have space for me, I understand. But if I do a good job, would you maybe help me get a residency somewhere else? That's what I would do. Go to your program director or mentor or whatever you have. Okay, we're coming up on 60 minutes right here, you guys. I gotta cut it off. 60 is like plenty, I think, but it's really awesome. You get 165 people and tons of questions and awesome chat. I got a little. Somebody asked, does tracheostomy with a pen actually work? I fucking did emergent trach like 3 nights ago. It was fucking crazy. I have a video coming on that pretty soon on YouTube, and so you guys can watch that. But yeah, that was the last one I did was a couple years ago, so it's pretty hairy, but it's pretty sweet. The only reason I was able to do that because lots of people taught me lots of different techniques, and I had some good mentors and stuff. Okay, you guys, I appreciate you being on. I'm gonna try a different mic next time, so maybe it's not lag, and maybe get some music, a little bit more music. It'll be fun. All right, take care, you guys. Have a good Tuesday and good week, and I'll see you next week. I'll let you know what time and what day. All right, see ya.